Keep watching OXL TV. Don't touch that. As you're watching this TV station and you touch the TV, you'll be shocked.
Hello everyone, welcome to City Gist with Sister Temi. Today on City Gist, I'll be talking about pica. Pica is a disorder characterized by the persistent eating of non-nutritive, non-food substance over a period of at least 1 month without an underlying medical or culturally accepted reason. This substance can include items such as dirt, clay, chalk, air, paper, soap, cloth, wool, pebbles, laundry detergent, ice, or foam. These things we all know we are not supposed to eat it, but there are some people that actually crave for this thing and they eat it. You see some pregnant women, when they are pregnant, they crave for all sorts of things. They want to eat the head of a monster, they want to eat big whale and stuff like that. So actually this pica is responsible for such things like that. There are people that actually eat things that are not food, like all what I have listed above. There are some people that actually eat foam, they eat ice, they actually chew ice as if they are eating rice or something. Some people, they eat dirt, they eat clay, they eat clothes, even air, so many things. And here are some key points about pica, things you really need to know about pica. Causes, what are the causes? The exact cause of pica is not fully understood, but it is believed to be multifactorial, including a combination of psychological, cultural, and environmental factors. It can occur in children, pregnant women. It can occur in children, pregnant women, individuals with developmental disorder such as autism spectrum disorder, and individuals with certain medical conditions such as iron deficiency anemia or mental health disorder. So it is this kind of people that actually fall into the categories of eating non-food substances. Then the symptoms of pica include persistent cravings or compulsions to eat non-food substances, which can lead to the consumption of potentially harmful or toxic materials. Some of these things are not harmful, some of it are harmful. Some over time it will become harmful when it becomes too much, when you don't find a treatment to it, when the cravings become too much and you're not doing anything about it. Over time it will actually have some side effects in the body. Other symptoms may include stomach pain, constipation, diarrhea, dental problems, nutritional deficiency, and intestinal obstruction in severe cases. And what are the diagnoses? Diagnosis of pica involves a thorough medical and psychological evaluation to rule out any underlying medical conditions and to assess for any co-occurring mental health disorder. Laboratory tests may be conducted to evaluate for nutritional deficiency or toxic exposure. Some people, it's just natural. Some people that have pica, it may be because they have an underlying illness that they are not even aware of. Some people, it's because of they have mental problems, and some it's just come. So you have to actually know the reason why you are eating all this non-substance food. So what are the treatments? Treatment for pica depends on the underlying cause and may involve a combination of behavioral therapy, cognitive behavioral therapy, family therapy, nutritional counseling, and medication. If necessary, it is essential to address any underlying medical or nutritional deficiency and to provide appropriate support and interventions to help individuals overcome their cravings and avoid consuming non-food substances. Complications. Pica can lead to serious health complications if you don't caution it, if you don't prevent it, if you continue eating all these non-food substances. over time it will be harmful to the overall health of the body. Pica can lead to serious health complications including nutritional deficiency, gastrointestinal problems, dental problems, poisoning, and intestinal obstruction. Therefore, it is essential to seek medical attention if you or someone you know is experiencing symptoms of pica. Pica is a complex disorder that requires comprehensive evaluation and individualized treatment to address the underlying causes and prevent potential harm. If you suspect that you or someone you know may have pica, it is very important to consult with a healthcare practitioner for proper assessment and management. Then how can we treat pica? Medical evaluation. Treating pica involves a comprehensive approach that addresses the underlying causes and provide appropriate intervention to help individuals to overcome their cravings for non-food substances. And here are some steps commonly taken to treat pica. One of it is medical evaluation. A thorough medical evaluation is essential to identify any underlying medical condition or nutritional deficiency that may be contributing to pica. Laboratory tests may be conducted to assess for iron deficiency anemia, zinc deficiency, or other nutritional imbalances. Then also we have behavioral therapy. Behavioral therapy such as cognitive behavioral therapy (CBT) can help individuals identify and modify the thoughts, feelings, and behavior that contribute to pica. Techniques such as habit reversal training, stimulus control, and relaxation techniques may be used to help individuals develop healthier coping strategies and reduce the urge to consume non-food substances. Then also we have nutritional counseling. Nutritional counseling can help individuals address any nutritional deficiency and develop a balanced diet that meets their nutritional needs. They may involve dietary modifications, supplementation with vitamins or minerals, and education about healthy eating habits. We also have family therapy. In cases involving children or adolescents with pica, family therapy may be beneficial to address family dynamics, improve communication, and provide support and guidance to parents or caregivers in managing the condition. So if you have a child, normally when children are growing like 1, 2, 3, they easily put things in their mouth. That one is actually natural because over time they will actually stop. Babies can put anything in their mouths, key, clothes, button, whatsoever for infants. But as time goes on, they will stop naturally. But you really have to watch your children. You really have to study them. If after 3 they still put things in their mouth, things that are not food, then you have to know what to do to be able to stop them and watch that it will not keep going like that. Then the medication. In some cases, medication may be prescribed to address underlying medical conditions or recurring mental health disorder that contributes to pica. For example, iron supplements may be prescribed for individuals with iron deficiency anemia, or medications can be selective serotonin reuptake inhibitors (SSR) may be used to treat underlying anxiety or obsessive compulsive disorder. So for those that with iron deficiency that is causing it, or those with OCD, then they can actually go for medication. They can go for supplements that will actually help them stop this habit. Then we also have environmental intervention. Removing or restricting access to non-food substance can help reduce the risk of ingestion and prevent harm. This may involve childproofing the home, keeping potential harmful substance out of reach, and providing safe alternative for sensory simulators or oral fixation. Then we also have continued monitoring and support. Ongoing monitoring and support are important to ensure the effectiveness of treatment and to prevent relapse. Regular follow-up appointments with healthcare providers, therapists, or support groups can provide encouragement, guidance, and accountability throughout the recovery process. It is important to know that treatment for pica should be individualized based on the specific needs and circumstances of each person. If you or someone you know is struggling with pica, it is essential to seek help from healthcare professional or mental health provider who can provide proper assessment and guidance on the most appropriate treatment option. So that is all we have on pica. Please kindly subscribe to all our social media pages on YouTube, on Facebook, on TikTok and Twitter, OXL TV, and on Instagram, OXL Official. Take care and goodbye.